I'm joined by Dr. James Ogutu, a lecturer at Kenyatta University in the School of Medicine. He specializes in medical microbiology and molecular diagnostics, and his research interests include mechanisms of pathogenesis of opportunistic infections in immunocompromised individuals. We will discuss aspects of coronavirus from its biology to the health concerns and safety we as a Kenyan people are determined to maintain. Welcome, Dr. James.
Thank you.
Short notice, but we appreciate your attention here.
Thank you so much for having me.
Welcome again. So we're just going to get straight into it. Help us as lay people and concerned people understand the biology of coronavirus. What is coronavirus?
Well, coronavirus, from the name corona, it means a crown. So when you observe the coronavirus under the microscope, because today we have techniques that can see the viruses, however tiny they are. So when you observe the coronavirus under the microscope, outside its envelope, you have what you call peplomers. Some people call them spikes. They are glycoprotein spikes. And these spikes give it a structure that resembles a crown. That is where the word corona comes from.
Right.
Now, this coronavirus is a zoonotic virus. It is a virus that can infect both animals and humans. And there are occasions in the past where we have found infections have been transmitted from animals to humans.
Right.
Of great importance currently is what you call the coronavirus, the COVID-2019.
Right.
The COVID-19 by the World Health Organization.
Break down the COVID-19.
Yes.
It's got a whole minute.
Yes. So what happens is that in 2003, there was an outbreak of coronavirus that caused a severe acute respiratory syndrome. So this has been designated as SARS coronavirus 1. Yes. Then after that, in 2012, there was another outbreak of coronavirus that was caused by the Middle East respiratory syndrome. It has been designated as Middle East respiratory syndrome coronavirus.
Right.
Then, right now, 2019, we have the coronavirus that was first identified in the epicenter in Wuhan, in China. This coronavirus was originally called the novel coronavirus 2019.
Why novel coronavirus?
Because novel means it's a new one. It's newly discovered.
Okay.
So after that, it's been designated as COVID 2019 coronavirus disease 19 because it was discovered in 2019. Now, the WHO did not want to call it the Wuhan coronavirus or the Chinese coronavirus because of stigma and
really.
the related issues. So this coronavirus actually originated in Wuhan in southern China. And it is believed that it was transmitted from bats.
Bats?
Yes, B-A-T, bats.
There's a particular animal that's not in Africa that was seen, but it's bats. You can confirm that it's bats that transmitted the virus, yes?
The information that has been given by the World Health Organization, by the CDCs in the US, tend to direct us to the bats. It is believed that there is a market in Wuhan where they were selling seafoods. It is also believed that in that market they were also selling game meat or wild meat.
Yes.
And that is how the bats came into the picture. So it is these bats that must have transmitted the coronavirus to humans.
Right. Break down the symptoms of COVID-19, coronavirus disease 2019.
Okay. The coronavirus disease 19, basically we are talking of three main symptoms. We are talking of fever, we are talking of cough, and we are talking of difficulty in breathing.
Right.
Yes.
But how can I know the difference between coronavirus and another flu or pneumonia? Because if I have a flu, definitely, probably, not definitely, let's go with probably I might have a fever or might have problems breathing. How do you differentiate the two?
Well, in the differentiation of the two, they actually overlap. So you will see that in flu, there are certain symptoms that you will also find in somebody who is having COVID-19. Now, the flu tends to have other symptoms apart from the three that I've just highlighted.
Right.
So you will also find sore throat. You will find running nose,
Right.
and so on and so forth. But actually, the differentiation basically lies in the diagnosis. So again, you may not be able to suspect whether it is corona unless you have the patient history.
Right.
So the patient history will be very useful in directing you towards differentiating as to whether it is coronavirus or whether it is regular flu.
Right.
The symptoms tend to overlap, yes. But you can confirm and differentiate when you do a diagnosis, a laboratory diagnosis.
Now, I have read from reports of WHO, reports on international media, that treating or testing for coronavirus is very specific. You don't really have to present symptoms of probably fever and difficulty in breathing, and automatically you get tested for coronavirus. Why is it so that it's very specific, for very specific persons, that this test is done?
I would say the specificity would be defined by a few things.
Right.
One, has this case traveled from an area which is known to be having coronavirus? For instance, if the person has arrived in Nairobi from Wuhan in China.
Well, let's put this one clear.
Yes.
World Health Organization moved the epicenter from China now to Europe, because Europe is reporting more cases. So let's move to Italy or Spain or France, which has the highest number.
So let's assume that somebody has arrived from Italy.
Yes.
Then that person is suspected to be, if they present with the symptoms that we have said, then that person can be a candidate for treatment. You know, normally when they arrive, like for instance in the airport, there is screening.
Screening, yes.
So once they are screened and they have been seen to be having symptoms that would likely suggest they could be suffering from coronavirus, COVID-19, then they can be tested. Another case is a person who is in close contact with somebody who is suffering from coronavirus, COVID-19.
Right.
For instance, a family member or a colleague or somebody who has come into very close contact with him. That person would be tested.
Right.
Yes. Number three is if a person is in a place where there is community spread, like you've heard of the cases in Washington State,
Right.
where there is, in the US, where there are community spread.
A lot of local transmission is what's contributing to the increasing number,
so
right?
somebody from that community who is presenting with symptoms that are suspected to be COVID-19 can be a candidate for testing.
Right. So,
but the specificity also could be explained by the fact that there are kits, testing kits, that can easily identify the virus.
So I want to take you back to testing. It is said within 2 to 14 days is when somebody might show symptoms of coronavirus. That is saying they were in contact with somebody or in a place where coronavirus was, let's say, it was an outbreak as such.
Yes.
So how do you advise a government like Kenya to control this kind of outbreak, to cease from being local transmission, at least control it to be of an imported case? I'm giving the instance of the first case in Kenya.
Yes.
This is a lady who's traveled across America, gone down to London in UK, and then come to Kenya. We don't want this lady moving about. The Ministry of Health says she was okay for the 8 days in which she didn't show any symptom. So as Kenya, how should we protect our persons to ensure, in case of any imported case, we are able to get the person just before they get into a lot of contact with other people?
Well, I think one of the things that probably the authorities could look into is to control travel, especially from areas where there are outbreaks.
Right.
That's number one. Number two, in cases where a case has been identified, then quarantine comes in very handy, that the person should be isolated. You know that, like for instance, in Nairobi, Mbagathi has been the National Isolation Center.
Yeah.
So that person can be taken for isolation and can be observed for those 2 to 14 days, which is the incubation period. But the rest of the other things that the government can be able to do, the authorities can be able to do, as we speak today, they have already prohibited conferences and gatherings with large crowds.
Right.
So that would be very useful in trying to curb the scourge.
Right.
But apart from that, you also know that it is normally transmitted from person to person. So we would be in a very safe place if we have social distancing or we maintain social distance. This is in a case where you see somebody is manifesting with the symptoms that would point towards COVID-19. Maybe the person is coughing, maybe the person has labored breathing, maybe the person is having fever. Then we are supposed to actually maintain some distance of 1 to 2 meters from that person. Why? Because COVID-19 has been found to be transmitted through respiratory droplets. Those are droplets that are generated when a person sneezes or when a person coughs.
Right.
But we have also seen that COVID-19 can also be transmitted through contaminated inanimate objects. We call them fomites. For instance, if I had coughed into my hand and I touch a surface, I can transfer the virus to the surface. And so another person coming and handling or touching the surface can then touch his mouth, his nose, or his eyes, and can then acquire the infection. So
is that the reason why we're being asked to wash our hands frequently and avoid touching our faces?
Precisely. We are washing our hands frequently because our hands can easily be contaminated. You know, in different cultures around the world, people touch their mouths, people touch their noses, people touch their eyes.
People shake hands.
People also shake hands. So we are advised to wash our hands regularly with soap and water. And also, whenever we don't have the soap and water, to use alcohol-based hand rubs or sanitizers. That would be useful in cutting the chain of infection. There is something called the infection chain.
Right.
Now, when you cut the infection chain at one point in the chain, then infection does not occur.
Dr. Ogutu, let me take you back a little bit. How long does it take for the virus to be alive? Let me use the word alive in case someone touches another a surface or someone says hello to another person, because World Health Organization still mentions that the virus is not airborne, or it dies very fast in hot temperatures, and it cannot stay for longer or on a surface that's on transit or something like that. Help me understand these points.
It would be very difficult to come up with a standard estimate of time, because the conditions in different places would vary. There would be a place that is dry. Even in Kenya, you would go to a room that is dry, and maybe the temperatures are very hot, and you would go to another room that is humid and wet.
With a hot room,
yes,
dry room.
In those kinds of hot rooms, they say the virus can survive for a limited number of a short duration of time. I have to talk on the basis of evidence-based facts.
Please do.
I may not be having evidence-based facts at the moment. Even WHO has not talked of evidence-based facts at the moment.
As far as time limits
time limits are concerned. But I think the more overriding fact is that we should maintain hygiene.
Right.
Are you getting me right?
I get you
because then if we were to talk only based on the time, then people would be complacent.
Okay.
People would be so complacent in trying to just limit themselves to maybe 20 minutes, 30 minutes. And by the way, there is some fear that I have here. You will see a lot of information, especially on social media.
Right.
And most of that information may not be accurate.
Exactly.
So that is why
just before we get into public safety, I still want to speak about the health and the biology part of it.
Yes.
Explain to me about the treatment. There isn't any specific treatment that has been put out there for coronavirus, but we have 68,000 people across the world who've been treated and tested negative afterwards for coronavirus. Help me understand the biology behind this.
Now, there are basically two main important things that you can collect from that information.
Help me out.
If 68,000 people have had the virus, and they have recovered from the virus, they are now negative.
They're testing negative.
Yes. Two things. One is that majority of the people who suffer from this infection only experience a mild bout of infection. In other words, up to 80 to 90% of the people who have this infection do not have a serious condition.
And the incubation of this just after testing and still showing mild symptoms of COVID-19 and getting tested negative after proper treatment is about what time?
Yes. So what we are saying is that at the time of exposure to the time that symptoms begin to appear, we technically call it the incubation period.
Yes.
We have said that that can range from 2 days to 14 days.
Right.
So for
the
some
period
people,
for self-quarantine.
Yes. So for some people, they may experience their symptoms after 2 days.
Okay.
For other people, they may experience their symptoms after 14 days, that is 2 weeks. Now, what does it mean those people were treated and they were actually declared to be negative? What would be treated in this case is the management, management of the symptoms that we are seeing. Maybe somebody has fever. So in the period, you are managing the fever.
Right.
Or they have an obstructed breathing system.
Right.
So you are managing the obstruction. You are giving support treatment for the obstructed breathing or the obstruction in the lungs.
Okay.
So you are not treating the virus per se, but you are managing the person so that their immune system would help them to overcome the scourge.
Right.
Yes.
Now
that is why I'm saying there are people who may have COVID-19, but they may not require any serious medical attention.
Right. So why is it affecting the older generation as per now? Most of the people, unfortunately, who've lost their lives are the older people in the generation, but the younger ones seem to be more susceptible, but are doing really well as far as being treated and testing negative afterwards is.
Yes. The older generation or the elderly have waning immunity.
Right.
So their immune system is started to wane. Is not as strong and as stable as when they were younger.
Right.
I am saying that the immune system would be very useful in overcoming the infection or the disease. But now when your immune system begins to wane, then you become prone, you become more susceptible to the condition.
Right.
That is number one. Number two, the elderly people normally also sometimes have underlying conditions. For instance, they may have a heart disease, they may have diabetes, they may have a kidney disease. That actually makes them more susceptible, and that is why you will find most of the people who succumb or who have severe COVID-19 are the elderly people.
Right. So with that said, there's only one confirmed case of coronavirus in Kenya. 21 countries in Africa have confirmed 1 or 2 cases of coronavirus.
Right.
So as a responsible Kenyan, how would you advise me to protect myself right now? Step by step, we start with hand washing.
Yes, I think as a responsible Kenyan citizen, one of the most important things is you need to avoid fear and fake news.
Start with your mind.
Yes. So because if there is fear and panic, then controlling the scourge will be difficult.
Yes.
Are you getting me right?
Given the panic buying of hand sanitizers, there isn't one in the shop right now.
So I think the first thing a responsible citizen should do is to make sure that we are not actually playing to the gallery of the fake news. So we must be able to, first of all, arrest fear and panic. That means our source of information should be valid and accurate.
From the Ministry of Health.
From the Ministry
World
of
Health
Health
Organization.
World
right?
Health Organization. Yes. So when you get that information, the sensitization of the public is very important. The public should be sensitized. How do I acquire the disease? Where is the disease found right now? Are you getting me right?
Right.
In this case, then we also inculcate the good hygiene habits. For instance, we wash our hands regularly with soap and water. And where we cannot find water, then we can use alcohol-based sanitizers.
Right.
Yes. Another thing, good respiratory hygiene.
And what is that?
A good respiratory hygiene is where when we cough, we cover our mouth either with tissue or handkerchief. Or we can cough into a folded arm.
The dab.
Yes.
World Health Organization has brought that
yes.
up.
Yes. That is when we cough or when we sneeze.
Okay.
The other things that we could be able to do, for instance, is we also avoid sharing of fomites, inanimate objects like spoons and utensils, because then in that way we can transmit the infection. But there are other measures that we can take
As per,
as per the regulations that have been put forward by the ministry.
That
Number
will be
one,
the government measures?
Yes. Avoid public gatherings where there are large crowds.
Would you advise that all these public gatherings be cut off? For now, church services have been allowed so long as there is hand sanitizers. For you, would you advise the government to cut off these public gatherings once and for all? 2 weeks to close school. Would you rather just cut it out?
Thank you for that question. But as I've told you, I am not supposed to abate and create panic.
But you're supposed to advise accordingly.
The government authorities have a mechanism and a capacity to assess the situation. It's called situation analysis. And all these,
so far it's
all
good.
these measures, measures are based on the situation analysis.
Right now.
Are you getting me right? So if the government has analyzed the situation and they say that we can avoid large public gatherings, but
still attend service?
Still attend service. Remember, they have also said in those services, in those places, there should be sanitizers.
Right.
And there should be mechanisms that people can also wash their hands. So as they monitor the situation, the instruction may change.
Right.
The measures may change depending on the existing current situation. So avoiding public gatherings would be one of them.
Right.
When you are traveling in the matatus and so on and so forth, they should have disinfectants or sanitizers to disinfect the hands and so on and so forth. That would be able to actually help the community and the people to protect themselves. But apart from that, you know that as a responsible citizen, if you suspect that you are having this condition, then you should quarantine yourself. You should self-quarantine yourself to observe over a period of time whether you could be suffering from this condition.
And just as you bring that up as we wrap up, I'd like you to help me and the viewers understand the conditions or steps of self-quarantine. What exactly is self-quarantine? What is expected of a person under self-quarantine, and what the government does to ensure that this person goes under this measure, and as well as check and maintain the quality of this person's health?
Now, a responsible citizen would suspect that they could be having COVID-19. Now, that would be based on a lot of things. their history, where they have traveled,
yes.
their contact with people who are suspected to be having this. And in self-quarantine is where you isolate yourself from the rest of the other people, even in your family, and you observe yourself. Are you getting me right?
Right.
Now, what would happen in this case? That person would be the best person to use a mask.
Okay.
Remember, the general public who may not be having COVID-19 are not advised to adorn masks.
So that is not a necessary condition
Yes,
as per now
as
in Kenya.
per now. But when you suspect yourself that you are infected,
Given the
then,
symptoms that you
yes,
mentioned, right?
then you can actually put on a mask, because this would then be able to protect the others. Are you getting me right? Because then in that case, when you breathe, when you sneeze, when you cough, the mask, which is called the personal protective equipment, actually protects the other people. Now, the healthcare workers can also have these personal protective equipment, like the protective gear that they put as they handle suspected or confirmed cases.
Right.
Now, these measures would be very useful in either bringing down or controlling the infections, or in actually preventing the infections from occurring in the very first place.
Right.
But in the healthcare sector, I think every hospital has what you call the Infection Control Committee.
Right.
Now, where these hospitals probably are handling suspected cases, then the infection control committees can swing into action and then advise the respective hospitals on how to go further. Yes.
Right. Let me ask, is it safe to bring the students in Wuhan into Kenya?
Is it safe to bring the students?
The cases in China have reduced. Though we have a ban on flights to and from China into Kenya, will it be wise to bring those students back into Kenya right now?
What would be the purpose of bringing them back in a hurry when, for instance, the cases are going down? That's number one.
Okay.
Number two, if they were to be brought to Kenya, we would still have to quarantine them.
Right.
Yes. I'm not saying that they should not be brought to Kenya, but I think there are mechanisms that the authorities have to assess the situation, and when it is the right situation, they can be able to bring them back to Kenya. We would all love to have them back at home. Yes.
Just give us a wrap about coronavirus and how to protect ourselves and the government response as we wrap up.
Okay, as we have said, the measures we have said are many. I would repeat. Now, to protect yourself from getting coronavirus, maintain the social distance. Avoid large crowds. When there is a suspected case, keep a distance from that person. If you suspect yourself to be the infected person, then you also self-quarantine yourself. The government will be monitoring the situation, and from time to time, they need to update the population, the Kenyans, on where have we reached very regularly. Because it is only the government that has the verified information.
Well,
yes.
Thank you very much, Dr. Ogutu. I will shake your hand, but I will keep my social distance.
We can wave at one another.
Just a few meters from each other?
Yes.
Right. Now, that was Dr. Ogutu, who helped us understand the biology of coronavirus and help us understand the importance of public safety and information. The government of Kenya has assured us it will regularly update us on the progress of the same daily as far as today was concerned. And with that, we're going to take another short break. Sports news coming right next. Stay with us.